Hello, everyone, and welcome back. Today, we have a fascinating topic to discuss, Paclitacel. Not only will we delve into the mechanism of action, but we'll also explore its role as a cancer treatment. So, let's get started. First thing, what is Paclitacel? It's a chemotherapy drug used in the treatment of various cancers, including Kaposi's sarcoma, breast, ovarian, and lung cancer. But what makes it so effective? That's what we'll uncover today. Paclitacel is a mitotic inhibitor that was first isolated in 1971 from the bark of the Pacific yew tree, which contains endophytic fungi that synthesize paclitacel. It is available as an intravenous solution for injection, and the newer formulation contains albumin-bound paclitacel. Mechanism of action, microtubules and cell division. To grasp the mechanism of action, we need to understand microtubules. Microtubules are essential structures in a cell that help in maintaining its shape and play a crucial role in cell division. During cell division, microtubules act like tracks, guiding the separation of duplicated chromosomes. It interferes with the normal function of microtubule growth. Whereas drugs like colchicine cause the depolymerization of microtubules in vivo, paclitacel arrests their function by having the opposite effect. It hyperstabilizes their structure. This destroys the cell's ability to use its cytoskeleton in a flexible manner. Specifically, paclitacel binds to the beta subunit of tubulin. Tubulin is the building block of microtubules, and the binding of paclitacel locks these building blocks in place. The resulting microtubule, paclitacel complex, does not have the ability to disassemble. This adversely affects cell function because the shortening and lengthening of microtubules, termed dynamic instability, is necessary for their function as a transportation highway for the cell. Chromosomes, for example, rely upon this property of microtubules during mitosis. Further research has indicated that paclitacel induces programmed cell death, apoptosis, in cancer cells by binding to an apoptosis-stopping protein called BCL2, B-cell leukemia 2, and thus arresting its function. Stabilizing microtubules. Here's where paclitacel comes into play. It's a microtubule stabilizing agent. When paclitacel enters the cell, it binds to microtubules, effectively locking them in a stable state. This stabilization prevents them from growing and shrinking as they normally would. Blocking cell division. When microtubules can't move and do their job properly, the cell's ability to divide is severely hampered. This interference with the cell cycle is one of the ways paclitacel combats cancer. It makes it extremely difficult for cancer cells to multiply and grow. Cell death. But that's not all. The disruption of the cell cycle often leads to apoptosis, programmed cell death. So, paclitacel doesn't just stop cancer cells from dividing, it can also induce their death, further shrinking tumors. Treatment. Now, let's talk about the practical application of paclitacel in cancer treatment. Oncologists use paclitacel as part of various treatment regimens, often in combination with other chemotherapy drugs or treatments like radiation therapy. Combination therapy. Paclitacel is frequently used in combination with other chemotherapy drugs to increase its effectiveness. This combination approach can target cancer cells from multiple angles, making it harder for them to develop resistance. Types of cancer. Paclitacel is used to treat a range of cancer types, including Kaposi's sarcoma, breast, ovarian, and lung cancer. The specific regimen and dosage depend on the type and stage of cancer, as well as individual patient factors. Side effects and management. It's important to note that paclitacel can have side effects, including hair loss, fatigue, and lowered blood cell counts. Your healthcare team will monitor you closely and may offer strategies to manage these side effects. Metabolism. Hepatic. In vitro studies with human liver microsomes and tissue slices showed that paclitacel was metabolized primarily to 6-A-hydroxypaclitacel by the cytochrome P450 isozyme 2-cypriot C8, and to two minor metabolites, 3-P-hydroxypaclitaxel and 6-A-3-P-dihydroxypaclitaxel, by 3-cypriot A4. In conclusion, paclitacel's mechanism of action as a microtubule stabilizing agent disrupts cancer cell division and can lead to programmed cell death. It's an essential component in the treatment of various cancers and is often used in combination therapy to maximize its effectiveness. If you found this video informative and helpful, please give it a thumbs up and subscribe to our channel for more educational content on medical topics. If you have any questions or if there's a specific topic you'd like us to cover in future videos, please leave a comment below. Thank you for joining us today, and remember, knowledge is power when it comes to understanding cancer treatments like paclitacel. We'll see you in the next video.